Looks good, Dr. Slead. You can go ahead and proceed and start whenever you're ready.
Okay, I will probably start in like 1 or 2 minutes. 1 second. Okay, I am gonna go ahead and get started. Can you guys hear me okay?
Yes.
Okay, perfect. So I'm going to be presenting the article evaluation of the efficacy of a live E. coli biotherapeutic product, ASB E. coli 212, a very recent study that just came out in JAVIM in the last issue. I think it's exciting stuff, pretty straightforward. It will probably be a little fast. I do have to make my way to an appointment after this, but we will get started. Speak up if you have any thoughts. So just getting right into the intro, they obviously introduced the idea and the fact that antimicrobial resistance is an emerging problem throughout, especially in vet med. And they just kind of go through that some of these ASB strains have been used or isolated in humans with persistent subclinical bacteriuria. There are murine models that have shown that the use of these ASB strains can not only decrease bacteriuria, but also can have anti-infective and visceral analgesic activity. For the use of these ASBs in humans, it can also improve their quality of life with UTI without adverse effects. And of note, for when these are being used, even when long-term colonization is achieved from these ASB strains, they generally don't develop UTI symptoms with no noted impact on reaction. In general, the mechanism is unknown, but it's presumed to be due to some degree of immunomodulation or bacterial interference. They go on to talk about the pilot study that was published previously that used the same strain mixed with 10 mils of saline and instilled into the urinary bladder of healthy research dogs. Of note, they did not achieve colonization in these dogs, but they also did not, where they used this ASB strain in healthy dogs, didn't achieve colonization, no obvious adverse effects, but they did get some variable responses. So 4 out of the 9 of these had a complete or near complete clinical cure by day 14. Of the 4 that were included in this number, 3 of them were truly cured and 1 did have persistent subclinical bacteriuria. And then 3 of those did end up isolating that specific ASB strain. These dogs, again, had no major adverse effects. 2 of them did have mild temporary self-limiting hyperexia. So the theory was that it was safe, potentially effective. And so the present study's hypothesis was that the use of this ASB strain would be non-inferior to standard antimicrobial treatment for dogs with recurrent UTIs. So this was a prospective, randomized, multi-center clinical trial. The inclusion criteria included dogs. I couldn't understand exactly the way it was presented, but I think 3 months of age or greater. I think just said 3 months of age. These dogs had to have lower urinary tract signs with greater than 1 UTI or positive culture associated with these signs within 12 months. They did note that incontinence was allowed if it was presumed to be a primary symptom. So if it resolved with antibiotic therapies. And then exclusion included various urinary comorbidities, specific types of these UTIs or cystitis, and then if cifoficin had been administered. They collected the data you would have expected, so a minimum database including SDMA. Urine was always collected via cystocentesis only. If these dogs then had a positive rapid bac or bacteria or pyuria, they were randomized into one of two groups. The two groups being group 1, which was the antimicrobial group, and then group 2 being the ASB strain treatment group. They then sent lower urinary tract clinical sign questionnaires to these owners for 14 days. That clinical sign score ranged from 0 to 17 and was one of the primary things that they evaluated after treatment. Included lower urinary tract signs like strange hematuria, plaquuria, etc. So for the group 1 study dogs, they received Clavamox at a standard dose, Q12, and then switched that antibiotic if needed based off of the susceptibility results. All dogs received a 7-day course, received a UA and culture on days 7 and 14. If symptoms developed or persisted, they were deemed a clinical failure and they were removed from the study. For the study dogs that received the ASB strain, they were all sedated with a combination of Dexmed and Torb. Sterile prep, the urine was removed from their bladder, and then the same concentration of the ASB strain E. coli was infused with 10 mils of saline. And so for these dogs, after they instilled the ASB, if they had some improvement, but no more than a 50% reduction in their clinical scores, at least from what I understood, correct me if I'm wrong, they received a second installation. But if there was no reduction in their clinical scores, they were deemed a clinical failure, and then they were just given antibiotics. UAs and cultures were also collected on days 7 and 14. And then for that subset that did receive a second installation, they also collected those same diagnostics on day 3. And then they note that similar to, or what they kind of found in pilot study and from previous studies, is that they use the resistance pattern to distinguish this ASB strain from other strains. And so generally they expect the ASB strain to be highly susceptible except for to ampicillin and ticarcillin. For their stats, they're basically trying to determine non-inferiority. So they set the margin advance, but it's basically a margin of 2 points in the clinical score. They use a multi-level regression analysis for the difference magnitude, use Fisher's exact for proportions, and then again determine an 80% power prior to, which would result in a minimum of 26 dogs, so 13 dogs in each group. So for the dogs, they included 34 total. So 17 in each group, ended up being 16 in each group. 1 in group 1 was lost to follow-up, and then another died for unrelated reasons. A fairly even split between the groups, so mostly female spayed dogs, a handful of female intact dogs, but group 1 did have a male castrated. Both groups did have a dog with an artificial urethral sphincter, and then group 1 had 2 dogs with historic ectopic ureters. For most of these dogs, there was no remarkable blood work abnormalities. There was a couple of descriptions about SDMA jumping around a couple of points, but other than that, nothing super exciting. And then really for all of these dogs, there was no major adverse effects, no signs of pyelonephritis in any of them. 13 out of the 16 dogs in group 1 did receive Clavamox specifically for the full 7 days, so only 13 had to have their antibiotics changed. And then 6 out of 16 in group 2 did have that second installation, meaning that, again, they had some degree of improvement in their clinical score by day 50, but not no improvements. The graph on the left here shows our bacterial isolates from each group on day 0. So the blue is group 1, the orange is group 2, and fairly unsurprisingly, lots of E. coli's, but I do think it's nice here that the ASB group did have a couple of different types of bacteria. And so the clinical cure results, group 1, the median clinical score, again, ranging from 0 to 17, was about a 6.5. None of these dogs were removed from the study. And then in group 2, the median clinical score was fairly similar with a similar range. 1 dog data was not included in day 14, primarily due to owner compliance with the clinical score questionnaire. As we can see in the ducks and whiskers to the right, there really was no significant difference in the reduction of clinical scores between the groups. So on the left, we have day 1 between group 1 and 2, looks fairly similar, similar to the median clinical scores. And then very notably by day 7, there was an improvement in clinical scores in both groups, but visually not much of a difference between the two. These are just kind of the numbers of that. So similarly, a fairly even split, or almost perfectly even split for the day 7 changes in clinical signs. It's a little bit more variable by day 14, but notably the p-values that we have here at the end show that there is no significant difference between those two groups. These are the two other figures or tables that they have. Table 2 just representing the results of the multi-level regression analysis. Basically, the importance being that the p-value was not significant, so non-inferior to the antimicrobial therapy. And then figure 3 is a cool one that just kind of shows the boundaries of non-inferiority, with non-inferiority being far to the right. We can see that we have it skewed to the left here. So the primary conclusion is that the ASB E. coli 212 was non-inferior to antimicrobial treatment. For the microbiological cure, kind of variable results here, we'll go through them based off of the group. So I split it up a little bit differently than it was presented. But basically in group 1, which again was the antibiotic group, most had a negative urine culture on day 7. Most also had a reduction in their clinical score on day 7. That one left did have a positive urine culture, but no change in clinical signs on day 7. At day 14, a little bit less significant. So 7 out of 16 had a negative urine culture on day 14, but 14 out of 16 had at least a reduction in their clinical score on day 14. Of note, 8 of those dogs had an increase when compared to day 7. So an improvement from day 0, but an increase from day 7. And then 9 out of 16 had a positive urine culture by day 14. For group 2 dogs, all dogs had positive urine cultures on both days. 3 out of 6 were deemed clinical failures. None of these dogs were urine culture positive for the ASB strain. About half of those had the ASB strain on day 7 or 14. And of note, 1 of the dogs on day 14 had an increase in their clinical score. But by the end of it all, 12 remained in the study on day 14, with 4 having kind of a similar increase in their clinical score between day 7 and day 14. But of note, 3 out of the 12 had a complete reduction in the clinical score compared to baseline. They did nicely include some longer term follow-up for these guys. And so again, between group 1 and group 2, I think there was 9 dogs in each group. There was about, so 2/3 of the group 1 dogs that we have the longer term follow-up for did end up having clinical relapses within 21 days. And only 1 was free of lower urinary tract signs until day 65. And then 2 of these dogs were euthanized for reasons unrelated to UTIs. And those are actually quite different from the group 2 dogs, where a lot of them had no lower urinary tract signs until, well, various time points, but quite different from the group 1 dogs. So, etc. A couple of them did develop some other disease processes, but at least from what we can see here is that they were free from clinical signs for a little bit longer. And so for the discussion, again, the results of the study do indicate that the ASB strain is non-inferior to standard antibiotics, and we can achieve a clinical cure for as long as 13 months, at least in that 1 documented dog. Importantly, none of these dogs had significant adverse effects. And even for these females, which had a catheter placed, the total procedure time was only about 20 minutes, and these dogs were able to be discharged as soon as the sedative was reversed. Interestingly, in previous studies, that's supposed to say ASB, not ASC, they were able to isolate the E. coli strain up to 60 days post-installation. Obviously, that wasn't looked at in this study. A lot of the dogs were not culturing the ASB strain, but it looks like it could go either way with that. Also importantly, 6 of these dogs did have a second installation, 2 of which were considered clinical failures. And so the question remains about like, when would you recommend a second installation or just a higher concentration of the drug? Because I guess some of these dogs could respond to that. And then kind of going back to the idea of if they are colonizing the ASB strain or not, 9 in the ASB group never cultured that specific strain, but most of them did have an improved clinical score on days 7 and 14. So then the question arises, or the theory arises, that there's probably some degree of antimicrobial therapy or activity, even if they're not colonizing. And then there's probably some degree of analgesic properties because of that improved clinical score. And there is a previous study that documents that these ASB strains can have analgesic properties, even when compared to something like Cipro for true UTIs. The primary limitations that they discuss are just a short time frame, although again, they did get to include some dogs with quite a bit of long-term follow-up. Because they did include dogs with a fairly infrequent amount of recurrent UTIs. They do remark that some of these sporadic UTIs, spontaneous resolution could have occurred. There was no cystoscopies performed in most, but some of them did, and there were 2 dogs included that had ectopic ureters. And then they do remark as well that really there was no molecular diagnostic that had been used to confirm the ASB product, but again, because of the pretty classic and telling susceptibility patterns, you could be pretty confident of whether or not it was there. And then because there was a little bit of heterogeny in the group 2 with the variable amount of infusions, that could have changed the results a little bit too. So in conclusion, they found that up to 2 intravesicular administrations of this ASB strain of E. coli T12 was not inferior to antibiotics and overall well tolerated. Next steps might be kind of centered around determining the dose and frequency, if there's any changes in response or lack thereof, depending on the type of bacteria you're treating for the UTI, and then also potential more confirmation of whether or not we can achieve this ASB strain colonization and whether or not that would affect long-term response, like in some of these human studies. I personally have not done this yet. During my residency, I can think of at least one dog where we talked about it, but obviously I would love to get people's input if they have done this themselves, and then obviously open the floor for more discussion.
Thanks, Tanner. That was great. One thing that I don't really know how to get around is the potential placebo effect that might be present, since the clinical scores are, questionnaires to an owner. And placebo effect is even documented in something that seems quite objective, like in seizure medication trials. Are we seeing benefits just related to owners thinking and wishing favorable things, or is it truly accurate? And I don't know how to potentially have a placebo arm where patients would fail to get any therapy. I guess you could potentially just do an NSAID and see if that is helpful, but I do worry just about that being a factor that could cause the owners to be happier. And I guess at the end of the day, if they're happier, that's the only thing that really matters. I guess it does matter if the infection is cleared versus causing further complications in the future. But that was one thing that just bothered me with it being more, it makes it easier to say, well, we didn't culture the avirulent bacteria, but the patients were better. Is it really because we're attributing a anti-inflammatory effect to that, or could it just be placebo effect that the owners are saying that they're better? And I'm not sure how to get around that or deal with that.
Yeah, that's a good point.
Is this actually like commercially available? Do you know?
Can you hear me? sure if my mic is working.
Now I can.
You can. I'm not sure if it's commercially available.
Hilla, can you just give us some? Can you just give us all some of this as one of the first authors?
Progress, but hopefully it will be available. I'm personally, my personal experience after this clinical trial was pretty good. So I'm really looking forward for it to be commercially available. And I even have some clients that like, they know it should be happening sometime soon. And I tell them to keep remind me every couple of months to see if it's available already. And also owners that were a part of the clinical trial and where we had recurrence at some point, even if the time until it recurred was, let's say, similar to like previous events those dogs had with antibiotic treatment, then those owners still prefer the ASV over an antibiotic treatment, which is another consideration we had. So bottom line, it's not available yet, but hopefully it will be soon. And regarding the comment about the placebo effect, so yeah, definitely this is also a limitation of this study. I think like the questionnaire we used, we try to make it as objective as possible. Of course, placebo effect is a placebo effect, but you know, it was like, for example, to quantify the number of times the dog had for example, was polacuric during the day. So they really needed to count the times, and then we had a score for every range. And again, this is not like, it's not dismissing the placebo effect, but it's pretty quantitative. So hopefully this maybe for in part helped with that. And also something interesting that we encountered even after we already wrote the paper, that in some dogs which had a positive culture for the original bacteria, that at some point where they were, they didn't have any clinical signs, and for like if they presented for some reason or just because I wanted to see them and ask the owners for more, take more detailed history and what's going on with the dog, and we repeated the urine culture. So we had like 1 or 2 dogs in which the ASB was not cultured. The original bacteria was cultured at day 7 or 14. And then suddenly we did see the ASB in like several months later. So this was really interesting as well. So maybe it was there in lower amounts. It took longer to form, like to colonize or something of this, but it was really interesting to see as well. And also we described, it's in the long-term description, like one dog that she did not culture the ASB, but she was free of clinical signs for a very long time. And then she got an antibiotic to treat some cough, and suddenly she had signs of UTI. So I'm not sure it's the ASB, but it's like we suspect it was, that was there until she got the doxycycline for the cough. So yeah, it would be better if we could culture the bacteria and make sure it was there. But I think there are some things that were going on that we will maybe find in the future. But overall, it was a very good experience, and I'm looking forward for it to be commercially available.
That's really cool. Thank you for sharing that and coming to this.
Sure.
Any other thoughts or experience from the group?
Another question, I think maybe more for Hila, is have you seen any of these like more long-term patients that are growing this E. coli, that the E. coli like changes in its resistance pattern? Like, do you have any worries about it becoming resistant to things like carbapenems or other antibiotics and then like serving as a reservoir for that?
We haven't seen any change in the susceptibility pattern over time. And this is a very like susceptible bacteria, so I think we were more worried that it would just with any antibiotic treatment it would be eradicated from the urinary system. And so the answer is no, we haven't seen any change in the susceptibility pattern, and at least from what we know in people where this originally came from, it does not seem to have the virulence mechanisms that would make it acquire resistance.
All right, well, I guess we will wrap up. Thank you everyone for coming, especially Dr. Chin. It's great to get your input. Very cool study, and thanks for publishing it.
Thank you for presenting it.
Thank you.